So hi everyone and welcome to Community Chats. My name is Sandra Arevalo and I'm the Director of Community Health at Montefiore. And today in these Community Chats, we're going to be talking about exercise and nutrition for strong bones and balance. And who can be a better person to be talking about this than Dr. Payal Sani, who has more than 20 years of experience as a physical therapist. And it's our neighbor now working right here around the corner in Work Rehab, which is our new partner with Montefiore. So we're very happy to have you here. And thank you so much for doing this session for us. Do you want to tell us a little bit about your job and what you do as a physical therapist?
Yes, thank you so much, Sandra, for that introduction. And thank you for everyone. Thank you to everyone for being here for this session today. I'll tell you a little bit about my background. I've been an orthopedic physical therapist for about 25 years now. And a lot of my work has been in research as well as treatment of patients with osteoporosis and balance problems. And hence I'm trying to get information that I have accumulated by my own research, as well as going through the latest research on bones and balance therapy. I've just tried to, through the medium of these kind of community outreach programs, try to bring that research to people, because I believe if a patient knows what's exactly going on with them, that can be really pivotal in their recovery. So I hope that I give you some new information, and we're always open to discussions afterwards. So I'm going to get started with my presentation.
Go ahead.
I'm sorry, Sandra, you
said
something?
No, go ahead. We're seeing your screen on this one.
All right. So my objectives for today's session are to discuss how bone and muscle health are closely related. Also to discuss how the right type and frequency of exercise can help prevent falls and fractures, to explore the role of nutrition and supplementation in bone health, and to discuss when to see a physical therapist versus attending a community exercise program. We'll also discuss some scenarios where both could be done. So I thought this would be an interesting topic to discuss here. So we're going to start off by looking at factors that affect muscle and bone, since we're talking about muscle and bone today, and see how it affects your balance and strength. So if you can look at the top of the slide where it says muscle. So muscle tissue can have two different outcomes. It can either be a really good, strong muscle, which we call as hypertrophy, or it could be a weak muscle and a muscle that doesn't have enough fibers, enough tissue. And that condition is called sarcopenia. Similarly, bone tissue, if you look towards the bottom of the slide, can also have similar outcomes. It can either be normal bone density, where the bone tissue is healthy, it's strong, or it could be osteoporosis or osteopenia or low bone mass, where there is a lot of bone resorption and the bone is not as strong. So both muscle and bone tissue are connective tissues, and they both can have two outcomes. It can either be a strong tissue or a weak tissue, to put it really simply. However, if you look in the middle of the slide, on one side, right under hypertrophy, it says physical activity, exercise, optimal nutrition. These are all factors that can lead to good tissues, that can lead to good, strong, healthy tissues. So the stimulus to produce hypertrophy in the muscle or to produce a strong muscle tissue are improved physical activity, exercise, having good nutrition. And the same stimuli can also lead to normal bone density or good and strong bones. Similarly, if you look on the other side, if there are stimulus like a sedentary lifestyle, there's lack of regular exercise, there could be other medical conditions including diabetes or absorption issues, gastrointestinal disorders, vitamin D deficiency, or any other nutritional issues. Same stimuli can lead to loss of muscle mass or loss of bone mass. If you look above and below, sarcopenia and osteoporosis. So by means of this slide, what I am trying to bring across a point here is that it's the same stimulus that's going to make a muscle strong and a bone strong, which makes our work actually easier, which means if I increased my physical activity, if I made sure that I have good nutrition, I'm doing regular physical activity, I'll make sure that my bones and muscles are strong. So that's just a gist, but let's go into a little more detail of how we can achieve this. So we're going to be focusing on the adverse outcomes. So a muscle versus bone adverse outcomes. And we just now in the previous slide, I'm going to move it back a little bit. So in the previous slide, we saw that how sedentary lifestyle, lack of regular exercise, malnutrition, and medical conditions, vitamin D deficiency, etc., can lead to adverse outcomes. And the adverse outcomes in bone are osteoporosis and osteopenia, where you don't have strong enough bones, you lose bone density. And the adverse outcome for muscle is sarcopenia, where you lose muscle mass and there's loss of muscle strength. So these are the two adverse outcomes that can happen. How do we change this? So let's also first review what happens when these two conditions are present. They could be present together, they could be present independently. So how does low bone mass and muscle weakness affect function? What can happen? There could be loss of balance, there could be loss of flexibility, postural weakness, there could be reduced overall stamina in an individual. Some of the other things that make the problem list are fear of movement. And believe it or not, fear of movement, also called as kinesiophobia, is a key component here that in physical therapy we hone in on to make sure that that kinesiophobia is not in the picture. For you to be able to move, you can't be afraid of movement. People with, and I'm going to explain this even more in my next slide, but people with any kind of pain, people who've had falls in the past, people who've had either fractures in the past, or simply they don't have to have an injury. They just know that they either have low bone mass or their balance is not good. People go into avoidance behaviors. So a lot of times we try to avoid things that we think may cause either a fall, a pain, or a fall, pain, or a fracture, things like that. So we try to avoid those movements, and that's what's called as fear of movement. Similarly, other problem list members could be, or other problem list pointers could be pain, a history of falls, as I suggested before, nutrition-related concerns like lack of education. We talked about optimal nutrition, but it's important for us to be also following a goal-oriented nutritional program, which means if you want to build muscle, we want to increase protein intake. If you want to build good, strong bones, we want to make sure that we're taking enough vitamin D and calcium in our diet. So we're going to dive a little bit deeper into this as we go further. And also exercise information overload. What that simply means is there is so much information on exercise out on the internet that a lot of times it discourages people, or it makes them or leaves them confused as to what type of exercises they should be doing to help a certain problem. So this is really a whole problem list of issues that an individual can have if they have low bone mass and muscle weakness. In case, of course, they have not sought out help. So that's why we're kind of pointing out on all of these deficits that can develop so that you can have the tools and the information to go and talk to your healthcare provider so something can be done about it.
Yeah, Dr. Sani, just very quickly, you have a note at the bottom of your screen saying stop sharing or hide. Can you click hide on there?
Sure.
Thank you.
Mm-hmm. Good?
Yes.
Is that good?
Yes.
Okay. All right. So I'm going to elaborate a little bit more on kinesiophobia that I explained before. And I'm just giving an example to explain what's called a fall cycle, which will make kinesiophobia a little bit more clear. So we're going to take an example here of an individual who recently received a diagnosis of, say, low bone mass or osteoporosis, or a patient who has just had a fall. And now after having a fall or receiving a diagnosis of osteoporosis, these are just two examples that I'm taking. An individual is aware that they have fragility of bones and a fracture risk, which means their bones are weak or their muscles are weak and they are at a risk of falls. So they have that knowing, they have that information in them. This information and the diagnosis that a patient receives simply is enough to create a fear of falls and injury in that individual. This fear may not be profound. It may be an underlying fear, but it does instill a fear of movement, a fear of falls and injury into an individual. Oftentimes, if this fear of falls and injury is not addressed for a long period of time, this can lead to more inactivity and lack of flexibility. This is what I was explaining earlier as avoidance behaviors. So people often feel if I don't go out often, if I don't exercise enough, if I don't go to the gym, maybe I will not have this injury that I might have otherwise. So fear of falls and injury, if not addressed for a long time, can lead to inactivity and lack of flexibility. Now, inactivity and lack of flexibility in itself is enough to lead to lack of muscle mass and strength. That means if you don't move, you get weaker. So the longer time goes by that you haven't moved, you haven't exercised, you haven't done enough physical activity, the weaker your muscles and bones are going to become. And that really just compounds your balance deficits, which just makes your balance worse even more. So it just becomes a cycle and goes like a cycle. And the only way we can stop this cycle of falls or fractures or injury or balance problems is by physical activity. So I just wanted to explain that fear of movement and avoidance behaviors that most people develop by just means of these two examples. So now moving on to what can we do about this? What can we do about these deficits? So there are two main determinants of bone and muscle health. First determinant is exercise, as we just talked about, and nutrition. So if you're doing the right kind of exercise, you have the right kind of nutrition, you've got the building blocks for healthy bone and muscle. Okay. Sandra, can you hear me?
Yes, we're hearing you fine.
Okay, because it kind of blocked on my side. All right, is that good?
Perfect.
Okay, sorry about that, everyone. So moving on from determinants of bone and muscle health, there are some questions that come up. Yes, we know we need to exercise. We know we need to have the right kind of nutrition, but there are some specific exercises that most people, specific questions related to exercises that most people have. So we're going to go through these most common questions related to the type of exercise. First one, the type of exercise. Mostly people question as to what type of exercise should I be doing? Should I be doing aerobic exercise, strength exercise, balance exercise? What's the right kind of exercise to maintain strong bones and balance? Another question that often comes up is how often should I exercise? Is it good to exercise 5 days a week, 3 days a week, 2 days a week, or can I get by just doing 1 day a week? Another question similar to this is duration of exercise. How long should I exercise for? Each session should be 20 minutes, 15 minutes, 30 minutes. What's the optimal duration of an exercise program? And then the most important one, intensity of exercise. How hard should my exercise be? Is it good for me to just go for a walk for 20 minutes? Or do I have to do weight training? And if I'm doing weight training, how heavy should these weights be? So these are some common some common questions that people have when it comes to exercise. And we're going to explore each one of them in detail. So the answers, I tried to kind of sum them up in this slide. The best kind of exercise program is a multimodal exercise program. Simply means you have to have a component of aerobic activity, which is cardio activity. You have to have a component of strength training, resistance training. You have to have a component of flexibility, which would be stretching, and a component of balance training. So all of these 4 components make the best exercise program. You can't just be going for a walk and think that it's going to make me strong. Same way, you can't just be doing weights or resistant bands and think that it's going to improve your stamina. So we need to work every component into an exercise program. Next question, for how long should you be exercising? So what's recommended is about 30 minutes a day. 30 minutes of exercises a day, and each session must include all of the components that we just described before. What's recommended also is if you put those 30 minutes a day together, it's about 150 minutes of physical activity per week, right? And it has to be moderate intensity. I'm going to talk a little bit more about intensity. So I try to put these exercise guidelines for bone building into this slide. So we talked about different types of exercises, which is aerobic exercise, cardio exercise, strength training, resistance training, balance and flexibility, if you go from top to bottom on the first column. The second column, guidelines for frequency. How often should I exercise? If you're doing aerobic activity, cardio activity, you can do that 5 to 7 days a week. And each session must be between 20 to 30 minutes, moderate intensity. It doesn't feel, or medium intensity, it doesn't feel too hard. It doesn't feel like it's really easy either. So it should feel like it is somewhat hard to do. Any kind of activity, if you can look at the last column, the intensity, it's moderate all the way around, which means it has to be medium intensity workout. If you are doing strength training, that also the weights that you pick have to be about moderate intensity weights. The frequency for strength training is about 2 to 3 times a week. Again, duration of each session should be 20 to 30 minutes at a time. And balance and flexibility, just like aerobic activity, can be done 5 to 7 days a week. Each session, again, 20 to 30 minutes and moderate intensity. So these are just guidelines. Sometimes people like to make their own exercise plan, and that's totally fine. You have to stick to an exercise plan that you know that you can be consistent with, because consistency is what's going to give you muscle strength. Consistency is what's going to maintain your flexibility and balance. So consistency is very important. So I often tell people that you have to pick the program for you that you are going to stick to, because that consistency is what's going to bring you results. Not doing exercise for a month or 6 weeks and then not sticking to the program, that's going to just undo all the hard work that you did for about 6 weeks or a month or whatever that was. But also at the same time, make sure that you're including different components of exercise into your general exercise program. You can't just be doing one type of exercise and think that it's going to give you all the benefits that you're looking for. Now, another common question that comes up often is whether I should go see a physical therapist, or should I join a group exercise program or join a class at the gym, or should I do both? So what I often tell people is that it really depends on what your goals are, what your wellness and health goals are. If you're dealing with a particular problem that needs attention, focused attention, you are better off seeing a physical therapist, because physical therapists are medically trained to diagnose your musculoskeletal problem and to help you get over that, get over the symptoms, to help you normalize muscle strength in a focused area. And that would be my first choice if I had an issue like that. But if you're looking for general health and wellness and you don't have any other specific issues going on, then it's okay to do a group exercise program. In an ideal situation, it's always good to first see a physical therapist, make sure that they focus on areas that you need more help with, and then you can transition yourself as soon as your physical therapy comes to an end. Before even it comes to an end, talk to your physical therapist, find out or pinpoint a program in your area, a group exercise program that you can transition yourself to when you're done with physical therapy, so that you can maintain that consistency we talked about earlier. So I would say physical therapy, then group exercise program. There will be a small transitional period where physical therapy and group exercise program might overlap, but that should be an ideal situation. Now, continuing the same discussion, like I was saying before, picking an exercise program should depend really on your goals from the exercise. I'll give you an example here. If you want to improve your flexibility, you want to improve your balance, you can choose an aquatic or a water-based exercise program. However, if you want to improve your bone strength, a water-based and aquatic exercise program is not going to help you for that. I just said that to give you a valid example to be more clear on what I'm saying. So you must always pick the exercise based on what your goals are from that particular exercise. If you want to improve strength, you pick a strength training program. If you want to improve your stamina, you pick a cardio-based program, things like that. So always keep in mind what your goal is from that particular exercise. If you're looking for general well-being, general wellness, and you're looking for general bone and health strength, bone and muscle strength, a generalized group exercise program, wellness program is the right thing to do, right? So based on what your goals are from that particular exercise, or what your goals are related to your wellness, is how you're going to look for an exercise program. The other thing that's really important and helps to make that decision between physical therapy versus community program is specificity of exercise. I touched upon this a little bit earlier too, where if you have a focused problem, and you want to first make sure that that musculoskeletal problem, that bone and joint problem is specifically taken care of, where you have all the focus on that, and then you can transition yourself to a wellness or community program. For in that case, you must always start by seeing a physical therapist first, so that they can evaluate you, they can pinpoint and discuss with you what muscle imbalances or joint problems exactly you're dealing with. And you can focus on those problems with your physical therapist, get better, and get ready to go into a community program. Also, dosing of exercise is very important. And we talked about the guidelines in a few slides ago. I can move back to this slide right here, where we talked about dosing of exercise. So dosing of exercise is the most important thing, because you could be walking for 15 minutes a day and say that I did my walking today, but look at the duration you need to do that for. You need to do that for at least 20 to 30 minutes. That dosing needs to be correct for it to actually give you some benefit. I always give this example. I share this example of medication versus exercise with my patients. So I always tell them that if you do need 10 milligrams of a medication, you need 10 milligrams of that medication. That 1 milligram, 2 milligrams, or taking it every other day is not going to produce the effect that you're looking to produce. It's the same thing with exercise. Movement is medicine. So you have to make sure that you're doing the dosing correctly, because if you didn't do the dosing correctly, even though you think you were physically active, it's really not going to produce the results that you're looking for. So we have to make sure that the dosing of exercise is done correctly. And what's the best place to start for that? See a physical therapist, because they're medically trained to dose your exercises. So they will dose the exercises for you. You learn what you need to do, and then go ahead and continue that dosing at a community program or a personal trainer, or just on your own with a program that has been suggested to you. Similarly, people who have involved medical histories, people who have other medical conditions that are in there, it's favorable for them to first start with a physical therapist to make sure that dosing of exercises, specificity of exercises, the goals that you want from an exercises, all of these things that are listed on this slide here are taken care of, and then transition yourself to a community exercise program. By making this discussion, I don't want to sound biased that you have to always start with a physical therapist, because community exercise programs bring a lot of value to your ongoing progress, to your ongoing recovery, and your ongoing health. So they have their own important spot in there. However, there has to be a gradual path from physical therapy to community exercise program, because we always come back to the same point of consistency. We have to make sure that we are consistent, and community exercise programs help us stay consistent with our exercises. So they're both important. We just have to, based on these factors that we discussed, we just have to pick what to do first. All right, now we're going to shift gears and go to nutrition for bone and muscle health. So just like we looked at pillars of bone health, pillars of bone health with regards to exercise, we're looking at nutrition for bone and muscle health. So as far as nutrition is concerned, there are three main factors: protein, calcium, and vitamin. These are the three components that are important for good bone and muscle health. We're going to take each one of them separately. So the first one up is protein. The recommended daily allowance of protein, which means what is the recommendation for you to have protein per day, is 0.8 grams per kilogram of body weight. And this is the recommendation irrespective of gender and is same for all ages. 0.8 grams per kilogram of body weight per day. That's how much protein each individual should be getting each day. Now, reality check on this, only about 20 to 24% of women and 5 to 12% of men 65 or older consume less protein than the recommended allowance. So oftentimes we think we're getting enough protein, but we are not. Why is protein so important? What does it actually do? So protein is really a building block of muscles. It is the small component of your muscle that is blocked together to make the entire muscle block. So it is a building block. Also, good nutrition leads to preservation of muscle mass and function. So if you have good nutrition, you'll have good strength, you'll have good muscle mass, and you'll have good physical function. Also, if you have less protein, if you're taking less protein on the other hand than recommended, your ability to exercise is going to be less. So if you're starting out with limited protein intake, there's only so much exercise you can do. So think of it as if you want to improve your muscle and bone strength, you have to make sure that you're getting enough protein. Because if you're not getting enough protein, you really can't progress yourself with your exercises either. Shifting our focus to calcium and vitamin D, the other two nutritional factors that are required for good bone and muscle health. So this looks like a busy slide. It has different age groups and recommendations, but I want you to focus on the first and second columns in the recommended daily allowance of calcium, in which we're not going to discuss the children requirements, but men 19 to 70 years of age need about 1,000 milligrams of calcium per day. This is a daily allowance. So men between 19 to 70 years of age need 1,000 milligrams of calcium per day. More than 71 years of age need 1,200 milligrams of calcium per day. Women between 19 to 50 years of age need 1,000 milligrams of calcium every day, and more than 51 years of age need 1,200 milligrams of calcium every day. Similarly, if you look on the other side, it's vitamin D recommendations between 1 to 70 years old. And these recommendations of vitamin D do not vary between men and women. So 1 to 70 years old, you need 600 international units or 15 micrograms of vitamin D every day. 71 years and older, 800 IUs or 20 micrograms of vitamin D every day. So why is calcium important? What does calcium do? So calcium is very important to maintain some important physiological functions of our body. Just listed a few over here, but there's many more physiological functions that calcium is needed for. So to maintain strong bones, calcium is needed, to maintain healthy structure of teeth, to maintain normal muscle function, to maintain normal nerve function, normal heart function, normal blood clotting. These are just a few examples. So what happens in your body metabolically if you are not consuming enough calcium? And we looked at your daily requirements. If you are not consuming between 1,000 to 1,200 milligrams of calcium a day based on your age, your body is going to draw this calcium out from your bones to accomplish these important physiological functions. Your nerve function has to be maintained. Normal heart function has to be maintained. These are just a few examples. Your body can't compromise on those functions just because you don't have enough calcium. So normally what happens is it just draws that calcium from your bones and makes your bones weaker. So that's why it's really important to have the recommended amount of calcium in your body. Consume that every day. Similarly, why is vitamin D important? What does that do? Vitamin D is, and this is the most important function of vitamin D in our body. Vitamin D is necessary for calcium absorption. You can take as much calcium as you want. You can make sure that you're getting those 100,000 to 1,200 milligrams. But if you're deficient in vitamin D, that calcium is not getting absorbed in your body. So you have to make sure that vitamin D, your vitamin D levels are also within normal range, and you're taking enough vitamin D every day. Besides just helping in calcium absorption, vitamin D also maintains muscle strength, reduces the risk of falls and fractures by making sure that your muscles are strong, and also regulates immune system, which was the biggest discovery we found out during COVID era, that vitamin D is really important for our immune function. So to sum this up, the nutritional information that I just shared, we have to make sure that you're getting enough protein, you're getting enough calcium, you're getting enough vitamin D during the day. As far as calcium is concerned, make sure that you try to get that calcium, 1,000 to 1,200 milligrams a day from food mostly. Now, oftentimes supplementation of calcium is discouraged currently, unless your healthcare provider suggests that you take calcium supplements. So as far as supplementation is concerned, it's always best to discuss with your healthcare provider to first see if you're deficient on calcium and vitamin D, and then discuss with them which one should you do. Calcium, the general recommendation is try to get it from your food as much as you can. And if you cannot, then talk to your healthcare provider and see what your options are in terms of supplementation. When it comes to vitamin D, there's not that many dietary sources of vitamin D that are available to us. So supplementation often is required. And in that case, also, you have to make sure you discuss with your healthcare provider. They could do a blood test on you to see what your current vitamin D levels are, and then a recommendation can be made as to what is the dosing of vitamin D that you may require. So, but these are good information pointers for you, so that you can initiate that discussion with your healthcare provider to determine whether you need any kind of supplementation for calcium and vitamin D. Another fun fact for calcium is that at one particular point, your body can only absorb up to 600 milligrams of calcium. So don't pack all your calcium in one meal. Just a fun fact to know, because your body only has the ability to absorb about 600 milligrams of calcium at a particular time. So spread it out throughout the day. So make sure that you're taking in not more than 600 milligrams at a time to allow for good absorption of that calcium. All right. So just to sum up this whole presentation, here are our 5 wellness checkpoints with regards to muscle and bone health. First of all, talk to your healthcare provider. Find out, now your healthcare provider can help you find out what your calcium and vitamin D levels are, and do you need to see a physical therapist to give yourself a head start. So that brings us to see a physical therapist. Give yourself a head start towards your health. Make sure if you do have a focused issue, they can help you get over that and teach you the right kind of exercises and strategies to make sure that you create a muscle balance, and then you continue your journey towards wellness by finding the right kind of community exercise program, so that you can be consistent with whatever you've learned from a physical therapist, and you can maintain that wellness status that you've achieved, maintain the gains that you've achieved from working with a physical therapist. Don't forget to include adequate calcium in your diet, and include adequate vitamin D in your diet to make sure that your bones, your muscles are strong, and you keep going on. So this brings me to the end of today's presentation. Hopefully I was able to share some good information with you, and we can open up for discussion now.
Well, thank you so much for this presentation. It was definitely useful. I was taking a lot of notes, and I hope that everyone who's listening to us right now was taking notes as well. And if you have questions, please start putting them in the chat, in the Q&A. But while we do that, let me just get rid of this here now. Yes, while we do that, I have a few questions for you. I was a little bit taken by surprise about the exercise guidelines slide. It said, 20 to 30 minutes a day of aerobic, stretching, and strength building. But at the same time, it's like the recommendation is 30 minutes a day, 5 days a week. So if you really need 30 minutes of each to work, you cannot fit it in 30 minutes, 5 days a week. It's more like 90 minutes a day. So how do you manage that? Because we all don't have the time to be doing 90 minutes a day of exercise.
Yeah, that's an excellent question, and it often comes up. And that's why we say that, say, if you're doing 2 times a week of a strength training program, right? Say, for example, I'll give you an example of strength training. So strength training, the recommendation is 2 to 3 times a week. So what you could do is start only twice a week and make one session as 30 minutes strength training session, right? So you can alternate. You have to do physical activity every day. So you can fit in 2 strength training sessions in a week where you're doing just 30 minutes of strength training, right? On the other hand, if you were now recommendations for balance is also 5 to 7 days a week, but you've got a leeway of 2 days there. So if you did 5 days and you did 2 days of only strength training, you can get by with 150 minutes a week. So it's the matter of picking what you need to do. To simplify, what you could do is you could alternate. You could alternate every day. You do strength training one day. The next day you do aerobic and balance. You could do 20 minutes of each. The following day you do strength training again, and then you keep alternating like that. One day strength, one day aerobic, one day strength, one day aerobic, like that. You only need 2 strength training sessions, and then it opens up the rest of the week for you to continue with your aerobic activity.
Now, you also spoke about consistency. And I definitely agree with you that a lot of us go to the gym, we work so hard for a week. And then after the week, it's like, okay, we forget until next January, right? When it's a New Year's resolution.
Yeah.
But how does consistency work out? Like, it has to be every day, or could also be like, okay, I only have time 2 days a week. And as long as I keep doing it 2 days a week, it's good. Like,
So this is again a really good question. And, there are some people who like to exercise every day. And there are some people who like to exercise only twice a week. And there are some people who will do the bare minimum that's required for them to do. So there's all kinds of people. You have to choose the frequency that you're comfortable with. That is the only, that comes most close to the recommendations. That's the only way you will be consistent with it. If you like to exercise twice a week, then you have to make sure that you're getting those twice a week sessions. So that helps to be consistent. If you are one of those who likes to exercise every day, then there's no problem at all. The other thing that really helps to maintain consistency is picking the same time of the day and the same day of the week. So it becomes like a schedule for you. So I often give this example to patients that I work with too. I say, see, now you're coming to the end of your therapy. You were seeing me every Tuesday, Thursday at 9 a.m. Make sure you do your exercises on your own when I'm done with you every Tuesday, Thursday at 9 a.m. Does that make sense? So that consistency of schedule, I think, always helps people to stick to the schedule, and it just becomes like a routine for them.
And I love when you said that exercise is like medication, right? Like, you cannot change the doses according to whatever you want. So with medication, we are told the same thing. We are told, take your medication at the same time every day. So that makes
exactly. Yeah. It just all falls in. And then, another thing that I would like to bring up here is you see a therapist for a little bit, you find what your dosing of exercise is, you know what your program is going to look like and what it should look like. Then you go ahead and either pick a community program, you go to a gym, or you do it on your own, whatever way you think you can be consistent with it. At some point, if that program feels like it's not as challenging for you, it's become really easy for you to do, you can always go back to your physical therapist to help devise a little bit more challenging program for you, right? So dosing can be changed. It's the same thing. Just like sometimes your providers will increase the strength of your medication. They will say, all right, you were taking 10 milligrams. I don't think that's enough for you anymore. You're going to take 20 milligrams of this medicine now. It's the same thing for exercise. You do a certain exercise, certain strength exercise, resistance exercise for a few months, weeks, whatever it may be. And at some point, your body is going to need a little bit more of a challenge. And that's the time when you go back to your therapist and look for a better program that gives you more challenge. So it's a progression. It's a progression. And it's always good to check in periodically with your therapist, with your healthcare provider to see what can be done to challenge and keep up the strength.
Mm-hmm. Now, I have a question for you about equipment. Is equipment always necessary? Do we have to, you mentioned the stretch band. Do we need weights? Or can we, there are a lot of programs out there that like Pilates, yoga, not all the time you need to be,
right.
Used to support.
Yeah, that's no, exactly. Not always. Equipment is not necessary always. There's a lot of different programs that you can, a lot of different exercise types that you could do without equipment. However, when you come to a point where body weight resisted exercises, which is what we call them, where you're not using any equipment, it's just your own body weight that you're using as resistance to build up the strength. At some point, it's not going to be enough for you, right? Say, for example, you're working with a 5-pound weight or a 2-pound weight for 2 or 3 weeks. After that time, it's not enough for you. It starts to feel easy. The same thing can happen when you're doing these active exercises also, where you're not using any equipment. So it's a good start to do these exercises. But when you get to a point where these exercises are not giving you enough challenge, then you do need to either progress the same kind of exercises that you started out with, or look towards some kind of safe equipment that can give you some resistance to continue your program. But you do need to find that moderate intensity exercise program, whether it's with equipment or without equipment. You do need to challenge your exercise, your muscles.
Mm-hmm. How do we know what type of exercise do we need most? Do we, how do I know that I need more balance or more strength or more cardio?
Yeah, so that's an excellent question because you're asking all the right questions. So that will depend on what kind of deficit or what kind of functional issue that you're facing, right? Say, I'll give you 2 examples. One example is a person who thinks that they are losing their balance when they're walking outside, or they can't walk for long enough of a time as they used to, or they can't stand for long enough a time as they used to. So this looks like a stamina problem. They don't have the stamina to do these exercises. So in that case, you need an aerobic, a stamina building program. On the other hand, there is a person who maybe their work requires them to lift and carry small objects, and they feel that they were able to do that before, and now it seems that they don't have the strength to do that. So that's where it brings you to strength training, right? So these are scenarios like that. And that's why I said it's best for you to see a physical therapist to find out where your deficit lies so they can specifically design a program for you. On the other hand, if your question is for a person who has no issues, no deficits, but they just want to keep exercising to stay healthy, then we need to follow all of those guidelines that I shared earlier, because those are health and wellness guidelines, right? So if there is something going on, you have a pressing issue, then it's best to see a physical therapist and devise a program and then go to a community program or a gym. But if you want to do just health and wellness, then follow the guidelines that I shared earlier and just do a multimodal program, which means you should have all the components into your exercise program.
Mm-hmm. And this question might be a little dumb, and I feel embarrassed asking it, but I really feel that it's important to know what is the difference between, going to a physical therapist or an exercise physiologist or what we call a personal coach. Is there any difference?
Yes, there is a big difference. Exercise physiologists they work with exercise science. A lot of times they have research jobs or they can facilitate an exercise program. Personal trainers are not medically trained, but they have good knowledge of exercise. They have good knowledge of progression, progression of exercise, but they're not medically trained. Physical therapists have a doctorate degree and they're medically trained. So if you have any medical conditions, it could be any medical condition. It doesn't have to be an orthopedic problem. It could be any medical condition. A physical therapist is trained to make sure that they can restore your muscle strength and your function, making sure that they don't make any of your medical problems worse. So physical therapists are medically trained. Exercise scientists are exercise physiologists are also scientists that work with exercise and muscles. They work a lot of times to facilitate exercise programs that have already been established, and they have a really good understanding of how exercise works and how progression works. Personal trainers have a good understanding of how exercise progression works, but they're not medically trained. So it would be great to start with a physical therapist and then work with a personal trainer to progress your exercise program. Mm-hmm. So that's just an example. I hope I did justice to that.
More of a diagnosis and prescription of what exercise you need to do, and then go to your personal trainer to help you achieve that.
Mm-hmm. Yeah, you could go to a personal trainer to help you achieve that. But if you have a pressing issue that needs more focused therapy, then it would be best to see a physical therapist.
Mm-hmm. Now, we're getting a question here. I have to say, are you familiar with Bone Builders? It's like an osteoporosis prevention exercise program. And
Bone Builders?
Bone Builders.
No, I am not familiar with this Bone Builders program.
Okay. And here's another one. I use a 12-pound weighted vest to walk. Has this been shown to help in increasing bone density?
Mm-hmm. Yes, there's a lot of research that shows that weighted vests can improve bone density. From what the reading that I have done, looked through research, there's no recommendation for a specific weight, but the recommendations are to increase the weight based on your tolerance. So the answer to 12-pound, I don't know if that is the right weight for you unless I work with you and we figure out if it's the right weight for you. But in general, weighted vests are known to improve bone density. Yes.
That's very good to know. Okay, you also were talking about the need to eat more calcium foods. And we might all know that, the main source of calcium is milk and dairy. But what about people who are lactose intolerant?
Yeah, so if there are people who cannot tolerate dairy, if you go on USDA and FDA websites, they do have standard lists of non-dairy calcium sources of food. Department of Health, New York State Department of Health also has lists of non-dairy sources of food. Having said that, people who have special dietary needs, I always recommend that they see a registered dietitian to get the right advice. So the recommendations that I made are general recommendations for people who do not have special dietary needs. The best thing to do is consult a registered dietitian if you have any kind of special dietary needs. But you could go on Department of Health website and look for lists of non-dairy sources of calcium and vitamin D.
Yes, thank you. So more on Bone Builders, it says here that it's an evidence-based osteoporosis prevention program out of Tufts University and some Cornell Cooperative Extensions offer.
Okay. All right. That's good to know. Thank you for sharing that information.
Yeah, that's really good to know. So I think we're reaching the end of this presentation. Thank you so much, Dr. San, for answering all of our questions and that great presentation. I hope that everybody here, all of our attendees, feel now inspired to go exercise. I know it's so hard. I know it's really hard, but we all have to do it. That's the reality of things, especially, I feel like as more time passes by, we get more sedentary in everything that we do, at least I remember when I was a child, I was happy standing up, change the channel in the TV. Now we have remotes
We have remotes.
for
Yeah.
everything. So we don't even stand up and sit down anymore. So yes, thank you so much. Do we need a referral from a doctor to go to a physical therapist, or can we just go to one?
Yes. So New York State allows you to see a physical therapist for up to 10 visits without a referral. We are a direct access state. However, a lot of hospital-based rehab facilities like our own at Burke, we do require a prescription from your healthcare provider to see a physical therapist.
Mm-hmm. Okay. And it is covered by insurance, right?
It is covered by insurance.
And we don't have to be injured in order to get one?
No, you don't have to be injured to see a physical therapist. You can see a physical therapist for a non-injury case, such as what we discussed today also. Yes.
Yeah, I think that's a myth that if we go to physical therapy is because we broke a bone or something like that. We don't know that we can actually see a physical therapist to help us, just gain some vigor, I guess. Well, thank you very much. Let me see. Oh no, hold on one second. I think I have.
Yeah, I was seeing a question there. Does your prescription need to be from an orthopedist or can it be from a PCP? Yes, it can definitely be from any of your providers. It doesn't have to be from an orthopedic. It can be from any of your healthcare providers that are caring for you.
Mm-hmm. Well, and I think that was the last question. So thank you so much for answering all the questions. And again, great presentation. I know we're going to probably have you again in 2025.
Sure.
6. Oh my gosh, 2026. So for all of our attendees out there, thank you for being here. And of course, we want you to also be joining more community chats. And once the recording comes live in YouTube, I'm going to be sharing it with all of you, no doubt on that. But for now, let's just try to exercise.
Let's just try to exercise, people. Yes, stay healthy, be well, everybody. Thank you so much. Thank you for spending the time with me. Thank you.
Okay, thank you, everyone. See you next week. Bye-bye.
See you.